Good morning. Today I'm going to talk to you reference to cholesterol and PSA. Cholesterol, you must have heard the name because you all are getting so much information on the cholesterol that your cholesterol should be normal. PSA is a test for the prostate. It's called the prostate specific antigen. It was approved by the FDA in 1986. Can you imagine that the prostate specific antigen, the PSA and the cholesterol, they are both in the body, they're both in your blood, and that's how the doctor takes your blood and sends it to the lab and check the results. And if the cholesterol is high, the doctor suggests you that you should get an echocardiogram or you get a cardiac catheterization, and you may end up finding out that there's a blockage in your coronary artery or in your carotid artery or in your arteries in the lower part of the body, or you have a damage to the heart itself. The cholesterol produces what we call cardiovascular diseases. On the other hand, the prostate specific antigen test, which normally is 0.1 microgram to 0.4 microgram, but if it's a little bit above, that means there's something wrong with your prostate, and it is due to prostate diseases. That could be due to prostate enlargement, prostate cancer, or prostatitis, or it could be somebody done a rectal examination, or it could be due to what you call after sexual intercourse, sometimes the PSA can goes up. So the doctor has to look at why the PSA has gone up. Now the question is why they are getting up. They are because of the metabolic disturbance at your cellular level. It is because of the free radical, and the free radical is produced in your body because of conditioned unconsciousness, because you are sleeping, but because you are eating wrong, you are eating too much salt, sugar, and lack of exercise, and especially the milk and the milk product, meat product. So these all produce what we call a metabolic disturbance leading to a free radical, a reduction in the antioxidant in your cellular level, and this will increase your cholesterol and also increase the PSA in your body. If anybody who is diagnosed with a prostatitis or prostate enlargement or prostate cancer, most of the time they also have heart disease. They may also have a high blood pressure, they may also have a diabetic, but most of the time they definitely has heart disease because they correlate each other. Anybody who has a prostate problem, they always have heart problem. It usually happens after the age of 40 to 45, and naturally the heart disease is also after 40 to 45, because we've been living, the day we are born, we start living a wrong way, our lifestyle, so it affects what you call the cholesterol as well as the prostate. Now you may be surprised to hear that the body is only a one unit. If it is going to disturb the metabolic disturbance at a cellular level, that means the whole body is disturbed at a cellular level. That means you can also have a diabetic. That means you can also have a high blood pressure. And that means you can have a low energy. You can also have what we call, you are prone to get a cancer in your body. So if a person is diagnosed with a coronary artery disease or an obstruction in the coronary artery, they may end up with a bypass or they may end up with a stent. But they may not see that what you call any changes in their body. But on the other hand, if the prostate get enlarged, or prostate cancer is there, and the doctor end up doing prostatectomy or radiation, it will produce biological changes in your body. That means you can have an incontinence. That means you have a leaking of urine, loss of erection, lot of ejaculation. And if you got a prostatectomy done through what we call a retrograde, what you call a transurethral prostatectomy or suprapubic prostatectomy, then you're going to have a problem in your ejaculation. You're going to end up with a retrograde ejaculation. So If your cholesterol is high, you end up with one kind of procedure, but you may not see the changes in your body physically itself because the heart is inside. Because somebody who did a bypass or a stent, you may not see what the complications are. But when you do an operation on the prostate, or you do any kind of radiation or any kind of what you call transurethral section, it's going to produce a drastic effect on your urinary system. So be careful. Make sure you question your doctor and ask him, does he really need it? Do you really need it? And why do you have that? So you can help yourself and take care of your body. Now, we have opened an office here now in Lucknow, especially on the prostate rejuvenation. And our object is to educate the doctors and the patients how to stay healthy so that they can have a normal life and live a healthy life as they are getting older in their life. I wish all of you a good day. God bless. Namaste. Amen.